The following is a local resident producers program. The program content is the sole responsibility of the producer and does not necessarily reflect the views or policies of CATV2, Oshkosh Community Access Television, the City of Oshkosh, the Oshkosh Cable Television Advisory Commission, or Time Warner Cable.
Hi everyone, welcome to another edition of Eye on Oshkosh. I'm Cheryl Hentz, along with my co-host, former Oshkosh Mayor and City Councilwoman Melanie Bloechl. On September 14th, we held a primary election here throughout the state of Wisconsin and certainly in Winnebago County. And one of the victors from that primary election is our guest on this edition of Eye on Oshkosh. She is the Democratic candidate running against incumbent Carol Owens for the 53rd Assembly District. We're very pleased to welcome back LuAnn Bird to the show. Thank you for being here.
My pleasure.
And congratulations. Congratulations on your win. You know, the primary is over, and now, of course, it's down to crunch time. It's time to get after the issues really hot and heavy. When you were here last time, we focused mostly on the reasons why you got into the race and so forth. Certainly, we want to cover some of those things that you want to tackle if you win in November and you go to Madison. But one of the reasons that you said you entered was because of Carol Owens' record, or the lack thereof, I guess. And no matter how much the electorate or part of the electorate may feel that Carol Owens does a good job, there's certainly an awful lot of people out there who feel that she does not. And in particular, the people who continue to challenge her. She faces a plethora of challengers, it seems, every time her two-year term comes up for expiration, and it's time for her to run again. So I want to talk about some of those things. And for the record, you know, we did invite Carol Owens to appear on an edition of Eye on Oshkosh. One of her staffers said that her schedule did not permit the dates that we had available for her. So we regret that we won't be able to have her on the show. Unfortunately, she's not going to be here then to address our concerns and the concerns of her constituents, nor can she speak to her record. But you've got serious concerns about the job that Mrs. Owens is doing. Tell us about those concerns.
Well, last year I worked as executive director in Madison all year, and I was the League of Women Voters of Wisconsin, and I was the League's lobbyist. So I spent a fair amount of time at the Capitol. My office was 122 State Street, so I was right in the heart of everything going on there. So first of all, I just have a general dissatisfaction with what I see happening in Madison, as do the majority of people I talk to that feel that we could be doing a better job with what's going on. But then I specifically looked at my legislator and really felt that we didn't have a voice in Carol Owens. She's been around for 12 or 14 years, and then I took a look at her record, which if you go to my website, luannbird.com, and then you click on Wisconsin Legislature, and then you click on the Assembly and get to Carol Owens and click on bills, a list of bills shows up that she introduced, and then I checked each one, and not a single bill passed. Now, after 12 or 14 years in the Assembly, I want a representative who can take the concerns that I have and that you have, or anyone that lives in my district, and actually be a voice for us and be successful at creating changes that will improve the quality of life in our district, or that solve the problems that we have right now. And I didn't see that happening in Madison. And so I quit that job to run. I've been out there now for months, and everything, all of the theories I had, the dissatisfactions that I had, are proving to be true. In almost everybody that I talk to agrees. We need a stronger voice. We need someone who can get something done in Madison on the issues that are important to the people in the 53rd Assembly District.
You know, I want to follow up on that for a second, LuAnn, because that very issue came up during one of the candidates forums. In fact, it was the candidates forum that you and I were at that the League of Women Voters had sponsored. And her response, as you well know, because you were sitting there,
I was there.
She said that she is not ineffective, that she has gotten plenty of legislation passed, but she is not, I forget the word she used, but it came down to egotistical. She's not so egotistical that she has to have her name on every bill, and that sometimes she passes things off to incoming and people who have less tenure than her in the Assembly. And I'm certainly not going to ask you to try and comment. Well, maybe I should ask you to try and comment on that. But my thought about that, as I heard her say that, was, well, that's interesting that you don't feel you have to put your name on every single piece of legislation, but you'll give away legislation that possibly can pass. You'll give that away to someone else, but this meaningless legislation, she'll put her name on, and then it fails.
We are not talking about legislation she puts her name on. That's another whole set of bills that's called co-sponsorship. And there are a whole bunch of those bills if you go to that website. We're talking about bills she introduces, she initiates,
right, and
takes
these were the
lead
ones she
on,
was talking about,
and
though.
she's ineffective at getting any of those passed.
Yeah.
So that's a different story. So that doesn't fit with what she's saying. What she's saying is that she's not, what I'm saying is she's not introducing bills or the right kind of bills that represent the district, or she's ineffective at working within her own party to get bills passed, which is different than saying, well, I just pass these off. We're talking her ideas that represent us, the people in the 53rd Assembly District. Nothing got passed through us, through her, that she introduced. Once she introduces it, it's up to all kinds of legislators to sign on or not sign on. But we're talking about initiation here. We're talking about leadership and representation for our district, and that's not happening right now. That's my argument. So,
and some of the most recent bills in the recent session or two, we had the cell phone bill, where she wanted to make it an offense punishable by a fine if you're in a car accident and it's determined that that accident was caused by your talking on your cell phone. That didn't go anywhere. She had this consciousness bill where a pharmacist could deny filling a prescription.
but she didn't introduce that.
Which she told us that was her.
She did not introduce that. She co-sponsored that, but didn't introduce that.
Did she not tell us that that was her bill?
That was certainly my understanding.
Yeah. When she was
Well,
on...
I'll have to check on that. That could be my mistake, you guys.
But in any event,
could be, but it
you
didn't
know,
pass.
No, it didn't
was
go
vetoed
anywhere.
by her. Right.
Thank you.
What are some other examples?
Well, if you look at her newsletter, there's two examples right here in her newsletter. She talks about introducing AB 603, enjoyed wide bipartisan support, and on March 10th, it passed out of the Assembly on a voice vote, but it's still awaiting action in the Senate. Then you look over here on PCBs, AB 915 did not make it to the floor of the Assembly before the end of this session. However, I plan on hitting the ground running next January. So she even admits in her own newsletter that these bills are not getting passed. And then her additional legislation introduced list here, the whole list, none of those have been passed. So those are some more examples of what I would say is ineffectiveness.
Why are these bills...
Other new legislators can introduce bills and get them passed. I checked other records to see, is there something I'm missing here?
Is there, do you have a feeling as to why they're not being passed? Is it that she's not articulating, she's lost the point in the bill, she doesn't get the point? Why aren't these bills being passed? Is it silly legislation like some of the cell phone call every teacher yes ma'am, yes sir? I mean, do legislators view her as insignificant? Why aren't these bills being passed? Is it the bill itself, or is it, the messenger?
It's probably a combination of both. Now, I haven't done a real analysis into the kinds of bills. I do know that some of those bills you're talking about, the cell phone bill, for example, is already covered under law. But I get a sense, well, I know from being around the district that she is not carrying a very strong voice in from the district. And I don't understand what happens within her own party, but it seems to me that she should have a little stronger influence there, having been around as long as she's been. I would guess that maybe she isn't fighting hard enough. Maybe her arguments aren't strong enough. You're talking staying up all night sometimes to fight for these bills. And I did hear her say on one of the shows she was on TV, well, it got kind of late that night, so we didn't get to my bill. Well, you know, I'm not going to let that be the reason my bills don't come up. You know, I'm going to keep on until we get to my bill. If that means staying up all night, I'll stay up all night. And then the other piece of representation that I've learned in the last year is that some legislators in some districts actually do surveys of their district, and they count on that survey every year, and that's exactly what I plan to do, so that I can find out how do people in our district feel about a certain piece of legislation. And I'll give you a great example. The challenges are tough in Madison. Where can we cut? That's what everyone's asking me. Where can we cut? And if you take the prison systems, for example, a great bill, a bill that was introduced, and again, I'm not sure why this didn't fail. It was not one of Carol's, but it was introduced that we should, at least I don't think so, we should, nonviolent first-time offenders do not need to be in prison, they need to be in treatment. Now, I saw a legislator who had done a survey in her district that showed 80 or 90% of the people support that kind of legislation. So if you can come in with some a strong voice again, I keep saying that, the people in my district say this is what we should do. That gives a legislator a little more power, if you ask me.
Well, and quite frankly, you're doing what you were hired to do. I mean, is to find out what is it that your district needs from you. I mean, the whole purpose for us having representation in Madison is to take our voice, because individually we have no say, we have no standing. That's why the system was set up the way it was. And if somebody's not doing those things, I don't understand. I mean, okay, nice lady, okay, but that doesn't get the job done. It's not enough to be someone's neighbor and a nice lady.
No.
You have to be able to put the pedal to the metal and say, we've had enough. I'm going to stand in here and I'm going to fight for you, because that's what I was hired to do.
We've mentioned the district a couple of times, and the 53rd Assembly District is extremely spread out. You were good enough to bring this map, and if our camera person here, our floor director, can just kind of zoom in on this a little bit. We have got, up here at the top, we've got the very northern part of Oshkosh, correct?
Yes.
And
the town of Oshkosh.
I'm kind of looking at this upside down, well, not upside down, but backwards on the camera, and through a paper here. Why don't you go ahead and show us?
I'll go ahead and explain that. We have the town of Oshkosh, the farthest north here. Then it picks up all of the towns around Oshkosh, including Rushford and Nepeuskin and Omro, Utica, Black Wolf. It just keeps wrapping to Kaimai, and then it goes to the south, and it picks up 8 towns in Winnebago County, and actually picks up the city of Waupun in the southern end of the district, and it goes east of Fond du Lac and picks up Empire, but it loops around Fond du Lac and it loops around the towns of El Dorado and Friendship. It's a very rural district. We're talking 16 towns, 2 villages, we're talking 2 cities, and then a good chunk of the north side of Oshkosh. But it's largely a rural district, so towns and small towns are the main issue. Farming, those are the issues that we're going to be talking about.
Okay, all right, very good. And so that is, how do you begin to cover an area that big?
You have to get out and really tour, first of all, and you do have to get into these towns. Especially campaigning, it's a great time to do that, to get to the city council meetings. I've been to the city council meetings, I've been touring school districts, and healthcare is a big issue, so I've been touring institutions where our elderly and disabled stay, so that I can get a feel for where these folks are, what their issues are, what's going on in these districts. Touring businesses is very helpful to get a feel. There are, for example, on education, there's 4 small school districts in my assembly district, and that doesn't count Oshkosh and Fond du Lac, which of course some of those students live in my district too. But I really feel the strongest part in education is how are the current caps affecting small districts? How does the funding formula work? 3 of the 4 school districts in my assembly district were looking at referendums next year. And I'm not sure what's going to happen in Waupun because their board voted down to go to referendum. So those are some concerns. That's an example of getting to know your district and carrying that strong voice back to Madison about what's happening. What's happening? Did you know that in Waupun, 50% of their land is prisons there, so their tax base is very small. Half of their city budget is shared revenue. So when you cut shared revenue, it's having a different impact on Waupun than it will on Rosendale or Oakfield
or Oshkosh.
Yeah, that's one of the questions that I had for you. Now, one of the reasons that so many legislators who voted for cutting shared revenue said that they did so was that local governments, local communities, local governing bodies, including school boards and so forth, had to learn to live within their means and become lean and mean.
We got mean, there's no doubt about that.
And the argument, of course, from the local leaders is that, hey, we're about as lean as you can get. There's not a whole lot of pork here. If you're elected to Madison, LuAnn, would you be in support of continuing to whack at shared revenues, or would you be willing to stand up and say, enough is enough? We need to start looking in-house right here to make some cuts.
It's been my observation that the big spenders are not local governments. And if you look at the analysis by the Wisconsin Taxpayer Alliance, it helps to understand those numbers. The 60% of the general revenues do come back to local governments. So it is a big part of the state budget. So it is a concern. Their spending affects 60% of our general revenue. So we do need to work together in times, especially when the revenues are not there. So they do need to share in that portion. It seems to me, though, that the 40% that stays at the state level is the area where we really need to, that's the part we control. That's the part where we can tighten our belts. And I think we look for the government waste. That's where there's places where we can streamline processes, where we can cut the red tape. For example, the university, Chancellor Wells told me that it takes 4 years to get a building that's privately funded through the state level. That's how many layers of red tape there are. In Indiana, it took 2 years. You know how that adds to the cost of a project when you have to wait 4 years? So if we can streamline some of that, if we can look at the different agencies or the different hoops that someone has to jump through, and someone's got to start questioning that.
Well, it may be better for business, too, to do it that way, because it's not just the educational system that's seeing this. It's all industry, and not that we want to rape and pillage, our wildlife and our wilderness and our environment to get this accomplished. But if we can cut some of this red tape, because we're losing businesses to other states because of this very thing.
That's right. And I believe that we can do that. I believe there's a lot of room there, especially if you concentrate on that 40% of our own budget that we spend at the state level.
Well, one of the things that I'm always perplexed by is when you talk to seated legislators and you ask them to explain to you the rationale for the huge cuts in shared revenue. Many of them don't even understand how the shared revenue program started. They don't. In order to move forward, I've always been taught that you have to understand where you come from first. Once you understand what the history is and how we got to this juncture now, only then can you move successfully, hopefully, forward. Now, if we have seated legislators that really don't even understand the history or the complexity of the history that got us to where we are with shared revenue, they're destined to be making the same mistakes, which is unfortunately what is happening right now. Shared revenue was brought about by the state of Wisconsin because they wanted to incentivize businesses into coming into the community and expanding. Thereby, the state went around and said, you know what we're going to do, businesses? We're going to give machinery and equipment tax breaks to you. Now, cities have the opportunity to tax those things. We're going to take that right away from them because we're going to make you exempt. In return for taking that tax revenue away from your local municipalities, we're going to give that money back to them through the back door through something called shared revenue. And we're going to come up with this elaborate formula that no one will ever be able to explain to you. But don't worry because it's safe. And what has happened is the mentality in Madison, or certainly the people that I've talked to when I ran for Assembly, was, hey, the state says that's our money. That's our money. And my philosophy was, no, you would be wrong. That money originally belonged to the municipality in order to provide infrastructure, in order to provide services for the very businesses that you want to expand. We cannot continue to allow businesses to expand if we can't take care of them. And how can we take care of them when you're lopping 40, 50, 60% off shared revenue, or here's better yet, for 20 years, you've never increased the percentage of shared revenue given back to us. It's never the whole amount that we should have had, but they've never even increased it. They've frozen it. So if you're up against that kind of stupidity, number one, I pity you because you've got a long road to hoe, and it's going to be difficult, and you're a very analytical lady. I mean, I've watched you on school boards. I've watched you delve into these things. Do I always agree with you? No. But, you know, the one thing that I do know about you is that you have never come unprepared. You've never taken on a project that you haven't dissected, resected, torn apart, looked at upwards, backwards, you know. And that's going to be I mean, do you feel like it's going to be difficult for you when you get there? Because you're going to work so incredibly hard. I have no doubt in my mind about that. And then you have this political gamesmanship that goes on that says, well, I got to defer to my party. Are you worried about any of that at all? I mean, number one, the lack of understanding about what's going on.
Absolutely. Worried because I'm the kind of person that likes to get things done. And I know what's going to happen down there because I watched it. I also do know when I was on the school board, it does take a while to build credibility and to get to know. So I am anticipating that it's not going to change overnight. I also am familiar with legislators, freshman legislators, who were able to get bills passed, even Democrats. So I do know it's still possible, given the current climate, that I will be able to I'm still optimistic that the issues that I'm talking about are issues that are bipartisan, that we can get something done. But when you talk about the current legislature, I think if you look at, and the struggles with shared revenue, I want to mention that I've been to 14 of the 16 town board meetings already, and I'm confident I'll be able to hit those other two. And I did meet with one town board individually so that I could get a feel for, so there's really only one left I need to get to, and I've been to all the village and city councils too. So I've gotten a feel for how has this affected them, and I've been able to talk with them and observe their meetings, and they've all cut back, they're all struggling. So I've got a feel for what I feel is going on out here. But I also want to mention that in Madison, if you look at the Taxpayer Bill of Rights right now, which is being proposed as a result of legislators who don't feel that they can control their own spending, I think it tells you what's really going on down there. And I agree actually with the Northwestern's analysis of that it shows ineffectiveness on their part. If they cannot represent the people and they have to create a constitutional amendment so that they can control their own spending, something is wrong in Madison. So for your viewers, I might want to explain that Taxpayer Bill of Rights is a constitutional amendment being proposed that would limit all of local governments. That means the city of Milwaukee would be tied to the same formula as the city of Oshkosh and the village of Rosendale and the city of Waupun, all to the same formula, and their budgets would all be locked up. And right now they're proposing 90% of the income growth. That's what's happening. And if that legislation passes, it'll take, let me point out, 2 complete votes, 2 separate legislatures, so it takes 2 years, and then it has to go to a referendum, a full vote of the people of Wisconsin. It takes 3 years to get that passed. If there are any unintended consequences, it'll take another 3 years. Let's say we get this passed and we realize this is not good for my small towns, and I convince them of that. It's going to take 3 years to get it undone.
Right.
So legislating fiscal policy in the Constitution is a bad idea. And it's a good example of how I think it provides evidence that we need change in Madison, that we need legislators that say, I can go down there and I can control spending. I can work with my local people and I can tell them, my 16 towns, by email, by holding some town hall meetings, I can tell them what's happening in Madison and what's proposing to come down the pipe. If they need to tighten their belts, let's work together. Let's have good communication so that they can choose to do that. And then let's look at the 40% that we can control. We can put freezes on that. I'm all for looking, and that'll cause us to go back and streamline the processes and look at what's waste and what programs do we really not need anymore.
You know, LuAnn, I'm listening to what you're saying, and it all seems very simple. I have a very simple question. The answer may not be as simple.
Oh, goody.
But I'm going to throw it out there anyway. Why is it? I mean, this really isn't that complex, and there doesn't have to be a lot of rocket science involved. Why is it that these folks, when they get to Madison, and certainly at the federal level, we don't see it at the local level so much. Well, sometimes with our city council we certainly do, but for the most part we're talking Madison here and at the Fed level. Why aren't these people running our state and federal budgets with the same mentality that we run our household budgets?
Now, that would be a mentality that says that we do not fund our regular operating procedure, operating budget out of one-time money. It only makes sense that we should really stick to, it's going to have to be revenues, sources, regular revenue sources that fund our operating budget. Seems to me that's the theory, because I'm watching current incumbents spin their tails.
Thank you for using the word spin.
Spin around in circles when they try to explain how they pulled all that tobacco money to bail themselves out in a time when the revenues weren't there to fund the programs that they've got now. Now what are they going to do? At some point you have to step back and you do have to prioritize, and we're going to have to work with our local levels of government. We're going to have to work with people and say, where can we cut? Because clearly the revenues were not there. Or I really favor, what can we do to be bringing in jobs and increasing the revenue stream as opposed to cutting? All you've heard about for 2 to 4 years is cutting. And in fact, when we were at a legislative breakfast by the transportation people this week, there was no vision. There was nothing positive that any of those current incumbents could stand up there and say. It was doom and gloom. And then us two candidates could come out shooting with our ideas. You know, what can we do to bring jobs in? What can we do to give some tax incentives for manufacturing to keep those leech jobs there? What can we do to reform healthcare? Why are these not priorities at the state level? These are the issues that are affecting everyday lives here in our economy. So those are the two, and of course education, you know, that's how can we create some technical jobs, set up some technical programs, training programs that can go along with these jobs. Where can we allow these organizations to work together, business and education systems, come up with some kind of bonding system for them? The revenue side, why are we not concentrating more on that? How come jobs are leaving to Canada? How come they're going to Minnesota, Illinois, and not coming here? Those are the hard questions that we need to be asking and concentrating on. And what do you hear about in Madison? The legislature spent all night trying to ban gay marriage. All night, mind you. They had 110 bills left at the end of that all-night session trying to ban gay marriage by constitutional amendment when it's already illegal by state statute in our state. Somehow they found it more of a priority than bringing jobs into our state. I didn't get that at all.
I want to touch on that because at that candidates forum, Carol Owens made some of the most, I feel, disgusting, reprehensible, hate-mongering comments that I'd ever heard come out of a person's mouth, someone who calls herself a lady. And again, it's too bad that Mrs. Owens can't be here on this show or any other show to address these issues, where she could actually be challenged on them rather than just, you know, giving her pat answers that are allowed at the candidates forum and then moving on to the next topic. But you were there, LuAnn. Her comments, as you know, were very hate-filled, and it told me that she doesn't have a clue what these issues are really all about. Obviously, I think I know where you stand, but for the viewing public, where do you stand on the issue of gay marriage, and or if people have a hang-up with the word marriage, let's call it domestic partnership, let's call it civil unions, but it comes down to basic human rights. Where do you stand on that? And the other thing that she had a cow about, no pun intended since she's a farmer, but was the use of contraceptives by minors, especially where they can gain access to prophylactics over the internet without their parents' consent. She was having a heyday with that too. Where do you stand on those issues?
Well, that's where Carol and I differ. And I really see a value system problem here. Who do we value in our society? Our our federal constitution, our country's founded on equal rights. And at this time, for people to be wanting to take those rights away, gay and lesbian people are Americans. They're human beings like you and I. Do I understand why some people have those preferences? I do not. But I fully believe that they have rights in our country, and that it's time that we start to honor those rights. And I'm with you. You know, marriage culturally is probably not acceptable, but rights are, and everybody that I talk to says, the majority, there's a few out there that really disagree, and those are not the people that, of course, you know, I would agree with. But the majority of people are definitely willing to accept civil unions. It's time. It's just time in our culture and in our society to, you know, to again, give the rights to the people that live in the Americans, us, you know, the people that are citizens, not just Americans, because we have a diverse culture now, not just Americans.
Well, I'm glad to hear you say that, because by her making the comments that she was making, and I understand that, you know, you can't necessarily have legislation that embraces everybody all the time, but basically, I mean, her comments were so hate-filled that it told me that, like I said, she doesn't have a clue what this issue is all about. She is clueless, but also she is choosing. You know, you talk about choice. She is choosing to represent only a segment of her constituents, and the hell with the rest of them. And that's the message that she's sending. And you know, I think it's going to come back to bite her.
The voters have a choice now. They can choose someone like Carol, who is continuously working on the issues that divide us, which is gay rights. They divide us. Abortion divides us, and guns. Those are the issues you heard a lot about in Madison last year. Or they can choose me, a candidate who will say, we need to be working on jobs, health care, and education, the things that affect everyone, the things we can reach across the aisle to improve all of Wisconsin. And I'm also happy to mention that I've been working with our Lieutenant Governor Barbara Lawton's Wisconsin Women Equals Prosperity initiative. I'm sure some of your listeners have already heard about that. She's been here recently talking about it. But in terms of economic development, if we just look at the W-2, the women that are out there now in the workforce that are working for very low wages, they're actually working poor, and actually a third of our single moms live in poverty. So those are all issues that we should be working on, and that's the choice. The choice is who do you want to represent you? You know, do you want someone who's going to work on those issues that divide us, or are you ready for a fresh change? Someone that says these are the issues.
And I think I couldn't agree with you more, LuAnn, because I think that once you approach those issues that affect all of us, and you get a handle on those, and you get your arm around them, and you start solving those issues, and you start seeing people back to work, and affordable health care, and healthy people again, people are much more willing to embrace other ideas. People, hey, life is pretty good, you know, I'm happy, why shouldn't everyone else be happy? It's the polarization, that's where the hate and the anger comes from. People aren't working, they're afraid. All they can think about is, you know, all the bad. And that's what's really unfortunate. In the same vein that Cheryl's talking about, this, what was it called, the conscience bill?
The conscience clause. The conscience clause bill.
Conscientious clause or something like that.
I'm perplexed by this. I think I have a pretty good conscience. It talks to me quite regularly.
Yes.
Where were we going with that? Pharmacists can arbitrarily decide that, ma'am, I'm not going to give you your birth control pills because I find that objectionable.
Right. Morally, I disagree with birth control, so therefore I'm not going to fill anybody's prescription on that.
But
okay?
you know,
or if you have signed a right to die, don't resuscitate me. But I disagree with that. I can resuscitate you. That passed both houses. And it had a lot to do with abortion. If a woman had something wrong with their fetus, and this doctor thought that you might be thinking about an abortion, this doctor would not have to tell you that there's something wrong with that fetus. And they could actually withhold information and not be held liable for that. And yes, that passed both houses and was vetoed by the governor, and that was a bill that we lobbied against that bill. And I want to mention, you brought up the teenage pregnancy thing. We spent an inordinate amount of time trying to keep federal dollars, Medicaid dollars right now that are flowing into Wisconsin that the Republicans several years ago voted for, that would allow the poorest teenage girls, 15 to 17, the ones that are poor, to get family planning services. So it's a preventative pregnancy initiative here The Republicans now feel that that's just a bad idea because Medicaid doesn't require parental consent. Now, and they have no control over the federal laws. So for that reason, they're going to kick out this preventative pregnancy legislation. And it was called the Save the Waiver. We worked in coalition with lots of other groups to keep that. Carol Owens, I'll have you know, called. They had the bill all set to go. We had the hearing. All of us showed up at the hearing and testified against that bill. It was a long day. They turned around, renamed the bill, and Carol Owens tried to get that bill on the schedule without having another hearing. Had to pull it off the schedule. They had to pull it off the schedule. That's kind of manipulating that's going on down there.
She should be ashamed
They had to
of
pull
herself.
it off the schedule because they hadn't even done a fiscal analysis on the bill. Then she did hold a hearing on the bill, and I went to that, but every piece of testimony had to be limited to the change. So we couldn't go back to the merits of the bill or talk about any of that. It had to be the date change. And the reason they did the date change is because it would have had such a horrible fiscal impact this year that they changed the date so that the fiscal impact wouldn't be so bad.
Wow.
Which is just a ridiculous reason to, you know.
I want to go back for just a moment to those two bills that you said passed both houses.
Right. The conscience clause.
Yes.
AB 67.
So since the time that Carol Owens was here, then it passed, because when she was here, she said that that was dead, that it had not passed yet. So it must have since passed. Where did she stand on both of those?
I need to look her. I know on the Save the Waiver, she was a co-sponsor on that bill. She wanted that bill to pass, the one for the teenage pregnancy, that
So they
prevents
can't
teenage
get-
pregnancy.
yep,
Right,
okay.
so that because of the parental consent.
And I would assume, and
Right.
probably rightfully so, that since the conscience bill was part of her, what she sponsored or co-sponsored, I'm assuming she voted in favor of that, and she probably voted in favor of this other thing, but that would be good information to have.
Right, I need to look that up.
But this just boggles my mind. Now, Carol Owens has professed herself to be a right-to-life individual. Okay. I can dig that. You have your right to your beliefs. I don't necessarily share those. But then you go and you help create a bill that prevents women from getting birth control so they don't have unwanted pregnancies. The very thing that we don't want to destroy is unwanted children, because we should all bear children whether we want them or not, according to the right to lifers.
And in the case of condoms, would prevent disease like AIDS that will kill people. Again, a contradiction when you're thinking in terms of being pro-life.
Right. So this would make me crazy, okay? Because, you know what, this to me seems as though rather than being a legislator, you should be, I don't know, in the religious field.
That's a good way to describe it. Who does not want parents involved in their teenagers' lives? We all
Right.
do.
Right.
I'm a mom. How far can you legislate family values, and at what point is that not our church's responsibility to work on with these kids, strengthening the family? I mean, you can't legislate some of these issues. I just totally disagree with how you solve these problems. Sometimes we agree that these are problems, and we agree teenagers should not be having sex. That's just bottom line. Who could, you know, abstinence is a great thing that we need to teach our teenagers. I talked with my daughter about it.
Right.
You just can't bury your head in the sand, though, to the reality that there are teenage girls going to have sex out there. And what if they decide, and I'm very poor, this is going to be the night? I mean, shouldn't they be able to get some kind of protection?
And,
Oh my
hello,
gosh.
especially when you're talking about
Why would we
Medicaid,
want
which
them?
is the taxpayer's dime paying for another child coming onto a system that unfortunately has shown from a documentary standpoint that this is a vicious cycle. Poor working class can't get out of the rut because it's poverty, and you learn behaviors. And we don't have to like it, but we have to be smarter about it. I mean, telling kids, now, I don't want you to have sex. I mean, I had a teenage daughter. I mean, hello, did I go up to her and say, well, Jamie, my goodness, you know. God, we had the talks. We went to the classes. I mean, she'll tell you. You do everything that you think as a responsible parent, but the bottom line is that at some juncture, it's about their decision making, and they're teenagers. And let's be honest, they don't always make the best decisions. That's why we have car insurance. That's why we have homeowners insurance. I mean, things happen because we can't be prepared for everything at all times, no matter how much we try to teach values. I mean, I think I'm a relatively valued individual. But what I really dislike is when somebody is so pompous and arrogant that they think that they can legislate and have people in a position that took a job that said, you know, I will do no harm.
You know, the more power we put in the legislature's hands, the less responsibility local people take.
Yeah.
So we have to watch that. I also want to mention that Barbara Lawton's initiative on looking at the economic prosperity of women, she actually developed 4 task forces that studied issues that affect women for the whole past year, and then we had a reporting out in June, sort of a leadership summit that I was a part of. And all of these task forces reported out what the barriers are to women's economic prosperity. Under health care, there were 3 main issues that affect women. Depression is one, the second one is domestic violence, and the third one is teenage pregnancy. So if you want to mess up a woman's life forever, you know, teenage pregnancy is one real barrier to economic prosperity for women in our state. So again, you know, what are we doing to solve that problem?
Well, we're writing wonderful bills that says, guess what? We've got a man who's saying that he, you know, in most parts, the pharmacist, you know, I'm just not going to dispense it. But here's my question. Does the pharmacist then also have the right to say, you know, I morally object to giving you Viagra? Can he do that too?
Oh, and Viagra is covered, by the way, where mental health is still not.
Yes.
I don't understand some of those priorities, but that's a really good point.
Well, you know,
that's a really good point. Who's
I would like to know.
Who,
you go tell a 300-pound guy that's 6'6", that's coming to get his Viagra prescription filled, that you morally object to erectile dysfunction. Hello?
I want to tell you, ladies, that I have knocked on doors in all walkable areas in this district. And I've been to town board meetings, and I've been to picnics, and I have been to Rotaries, to Kiwanis, to Lions groups. I have been everywhere. I have not had people come up to me and say, these are the issues that are important to me. Now, there are a few that will ask, what's my stance on abortion? But I'm not hearing people come up and say, you know, we really want this conscience clause passed. Or we really want you to take away family planning services from women. I don't hear about that. You know what I hear about? I hear about the jobs that the Leach people lost. I hear about the 60-year-old men who just got wiped out of their jobs are gone, and they wanted to work for two more years, and they're out looking for jobs and they can't find them. I hear about that. I hear about the Oshkosh Area School District proposing to cut the paraprofessionals at half-time level, proposing to cut their benefits this year. So they are going to lose their benefits. They're half-time workers to begin with, and guess what population we're hitting again? All women and the lowest paid in the system. Those are the stories I hear about, and I heard a woman tell me her story as I was going door to door, and she's going to have to quit, and it's breaking her heart because she works with those little, you know, 4-year-olds coming in, the early childhood people, and she just loves her job. So now we're going to go after the low, you know, those are the stories I hear about door to door. The health care, the people that can't quit their job yet because they wouldn't have health care benefits, and they're, you know, the lady with the big brace around her neck that just got out of surgery, and or the people that, or the farmer. Let me tell you about the farmer I ran into this week. Came up to me and he said, you know that my health, and he said, I'm so glad you're running. He's a school board member. He said, I'm so glad you're running. Let me tell you about health care. I have to pay $300 and something a month to get health care, and I have a $5,000 per person deductible with a maximum of $10,000, so I pretty much only have catastrophic health care. And then as we talked, he went on to tell me the real story, and the real story was, I suffer from depression. None of my mental health is covered under that deductible. He says, so I can't go to all the doctor's appointments, see my psychiatrist as much as I'd like to. I really try to keep that at a minimum. You know, these are the stories that I hear.
It's deplorable. We've got some, I'm sorry.
No, go ahead. Go right ahead.
We got some viewer questions, and I want to get them in because these folks took the time to write in. And we can do them quickly so Mel can jump back in here.
No, go right ahead.
What's your position on mandatory seatbelt use in vehicles where the police would have the authority to stop you if you were not wearing your seatbelt?
Well, seatbelts save lives, so I have no problem with that.
Okay.
Seatbelts save lives. I'd look at the statistics on that too.
Make sure they're in school buses.
Well, wouldn't that be great?
But you would
Wouldn't that be great?
you would
The only
not
argument-
oppose that if it's the primary reason that they're stopping you then. Because that's what's kind of been bandied about is, see, right now, they have to
that's
stop
fine
you
with
for
me.
some other reason.
No, that's fine with me.
Okay.
And sometimes that can be a way to stop someone for other things. I see all kinds of possibilities on that.
Okay. What is your position on a statewide no smoking policy
I would support
for all
that.
public places in Wisconsin?
I would support that in a
Okay.
heartbeat because there's been some real unfairness here in the Oshkosh area. And if that's the trend where people are going, why not level the playing field? And I would work with the Oshkosh Restaurant Association.
Yay.
Yes, I would listen to those folks about what their thoughts are and what they think would be a fair.
Somebody
what could
has to
help
listen to
them.
them.
You
maybe,
bet. We
maybe
know the
even as we
non-smoking
speak,
arguments.
they're being listened to
We
in
do,
mediation.
we do. That's right. So that's been a tough issue for the Oshkosh residents. But I am proud to say that I've seen some compromise come out of that, which is good. Well, you can't compromise on the cancer side because everyone knows what happens there. But you certainly can see some restaurants making the effort to take care of the problem themselves.
But see, that's
which is
exactly
great.
the point, you know.
Which is great.
Not to get into local politics now, but you know that's exactly the point, LuAnn.
I
is,
like that.
Is that the restaurants were always willing to compromise. Breathe Free Oshkosh wasn't, and
Well, I don't know all the inside scoop there. So
well, we do.
I know you do.
Would you support the plan submitted by the state superintendent of schools to spend $11.2 billion with a B, dollars to expand 4-year-old kindergarten and reduce elementary class sizes?
If we have the revenues, that is the best place to invest. But I have to look at the budget. I have to look at where we're at right now, and I have to look at where we would get those kind of dollars before I could answer that question. Do I support 4-year-old kindergarten? Absolutely do, because a lot of our kids are in daycare now, and that's not the best place. 85% of the women are working now in our state. We're one of the highest in the unions. So child care issues need to be addressed, and the pay for child care needs to be addressed, so there's more issues. Maybe 4-year-old kindergarten is something. Again, I would have to look at that, take a hard look. We're not in good times right now where we can increase our spending.
I was just going to say, taxpayers paid for daycare. No.
No, so we have to get beyond that. We have to look at preparing children. No. That's not our role at all. But does 4-year-old kindergarten prepare children so that they come
They're still babies. They're
Well,
4.
My kids. Didn't you take your kids to the?
Sure, but
I did.
part-time and not,
Yeah.
you know,
Yeah.
it wasn't, it was like
Yeah, but
fun.
you
Here's
know
the
what,
Play-Doh
though?
and have a good time.
Right. But there are kids that need to be prepared. They're coming in at such different levels. So if it helps that, 4-year-old kindergarten's great.
Okay.
If it helps that. But
What-
again, you know, you got to look at the specifics on that
Yeah.
and the statistics. And how about some accountability? If we're going to pass this kind of legislation, where is it going to impact the system, and how can we measure that and say that it's actually working? What are the measures that say these are where kids, if they're in 4-year-old kindergarten, are actually more prepared, and how does it then help them with their learning all the way through? I think those are the tough questions as legislators that we need to ask.
Okay.
So we're not just a babysitting service.
Okay, good.
We got that. All right. What would you propose to provide relief in health care and prescription drug costs? And second part to that, they wrote, are you in favor of prescription drugs being ordered from Canadian drug manufacturers?
Absolutely. I certainly am. The stories I hear about that, and I talk to the medical profession as well as people on, you know, and listen to what the experts are saying, and they're saying that the majority of those drugs are safe. It's just crazy that we should have to go out of the state. So while I'm giving my 50 constituents in the 53rd some relief on this, we also need to look at what we can do to lower our costs, because we want to keep jobs in our country too, you guys.
That's right.
We don't want to send business out of state forever, but until we can figure out what we can do to contain our own prescription drug costs, and it probably goes back to a whole health care revision that needs to happen.
So okay, so getting the prescription drugs from Canada, then that would help relieve some of the costs for
It
folks.
does right now.
But do you have some ideas on where you would be able to cut or provide relief in healthcare as a whole?
Well, the one thing that I know is that I have to choose, pay a network, and I have to pay an insurance company, I have to pay a doctor. And according to the Wisconsin Citizen Action, 25 cents on every dollar goes to administration. I firmly believe that we can rearrange that system and make those dollars stretch out so more people are covered, so we're no longer cost shifting for the people that walk into an emergency room that are working people. I know the issue of non-working homeless people, that's separate, but we're just talking about the people that are capable of working. getting those people into the workforce, and then having a health insurance system that a business can afford to finally pay a portion of, even small businesses, for their employees. I talked to a guy, again, you know, when you're out there in the field, you know, talking to the people, you can hear what's going on. I talked to a guy that owned a small business in the Brownsville area, and he will not pay for an insurance plan for his small business, because if there's a catastrophic injury, he's dead in the water, and everybody has to pay in his small business, so he just gives them a small cash amount. And they're on their own. The question I ask, this is the tough one, is healthcare a right or a privilege? And it depends on who you're talking to.
Should be a right in the United States of America.
Absolutely. And then if that's the case, we need to solve the problem of unaffordable health care for people in our state.
Okay.
And I'm excited to take on that challenge, because that's the top issue I'm hearing about as I go door to door.
Oh, I'm sure. Okay, and last question from viewers. Would you favor relief for Social Security recipients by removing the state taxes from Social Security benefits?
Ooh, it doesn't make a lot of sense to me to tax Social Security, but again, we're not in a climate where tax cuts. I'd have to take a look at that one and do a little more research on that. Okay. It doesn't make sense, but again, changing a system like that at a time.
Yeah, and that system is not going to be one of your easier tasks to
That's
undertake
right.
as well. Wow.
That's right.
That's like taking on the whole healthcare industry. One of the things, how much time do we have left? Am I good to ask?
Well, yeah, we've probably got about 6 minutes.
Okay. Because the majority of your questions in your district do relate to healthcare issues, some time ago the state of Wisconsin removed what they called the determination of necessity or certificate of need. Are you familiar with that at all?
No, I'm not.
What that was, and I'll put it in a nutshell, and this might be a little too simplistic. I'm sure there's probably a lot more to it, but in a nutshell, what it did is it required medical facilities, hospitals, clinics, and the like, that anytime they made major equipment purchases, that they literally needed to go to the state and show documentation and statistics that showed that indeed this community was in need of this type of piece of equipment, be it CT equipment, ultrasound, MRI, lithotripsy, any big expensive piece of equipment. You know, these pieces of equipment run multi-million dollars. What has happened in our environment here, just in Oshkosh, where we have Theta Clark, who is providing Theta Care now, we have Aurora, and we have Mercy Medical Center. Just in the recent weeks, Mercy Medical Center has hit huge layoffs. They're letting a lot of people go. And I think much of that is attributed to the Aurora factor, as it's now called, or the Aurora effect. And neither one of these huge hospital facilities can support themselves because the numbers in the city of Oshkosh have not changed. You've just split the number of people that are being taken care of in order to support any given facility. My concern here is that, you know, we keep talking about what's driving health care costs, and unfortunately our legislator here in the 54th Assembly doesn't quite get it. He thinks that health savings accounts are going to be the answer to control health care costs.
I'm sorry, we're running out of time here.
Okay,
so.
To draw this to a close, would you be interested in looking at re-establishing this certificate of need or determination of necessity for the larger facilities to have to prove that these large equipment purchases are actually a necessity?
Well, that's a simple answer, so it won't take long. But it's time for the government to step in and help out with the healthcare costs. And I totally agree with you. And I've talked to Representative Underheim about healthcare, and I've disagreed with him all along that this system is taking care of itself, because we still continue to see 30% and 40% increases in some markets in healthcare. It's just out of control, and the government intervention is needed right now. The role of the government is to solve the problems that the private sector cannot, and in healthcare, I believe that the private sector is proving that it cannot control these costs. And the two hospitals we have in Oshkosh provide enough evidence that there's something wrong. Now, a full government control is not what I favor, but I do want to look at different systems that have worked out there in other states and in other countries, and what can we learn, and what, again, how can we make that a top priority in Madison so that our seniors can afford food and not choose between food and drugs, and our small businesses can thrive again, and what,
Right.
you know, our bigger businesses too, not just small businesses. How can we make that a priority? So yes, I would favor some sort of government intervention. I don't know if that specific.
No,
plan,
honestly,
I
think that's very true, and just because local municipalities in the state have been talking a lot about duplication of services, this is precisely what's going on in our healthcare industry. We have duplication of identical services, splitting the community, and you have all these huge costs being incurred, and nobody can pay off the amortization. It's like buying a $3 million house, and you got two people living in it with one income.
Well, maybe what they could have, because I do think competition is good, we need it.
In healthcare, it has not worked, though. It is shown to be very ineffective.
Well, but maybe there's a way that it could work, and maybe that's by sharing major equipment.
Never happen.
But, you know,
it will never happen in this lifetime. Not with these organizations, because they all want a piece of the pie. And if competition,
but there are organizations that do share things and work together, but not in this community.
No.
You're right. Not in this community. Further north, they do.
Well, in some cases maybe, but it is a very difficult situation, and it needs to be addressed.
And I'll say this. You cannot solve our problems at the same level of thinking that created them, and I say it's time for new blood.
All right. On that note, why don't you look into camera 3, take about 30 to 45 seconds, LuAnn, and tell folks why they should vote for LuAnn Bird for the 53rd Assembly District on Tuesday, November 2nd.
Thank you. Well, I have a record of getting things done for the people in this community. I worked on the Oshkosh School Board and made sure that all of our schools were wheelchair accessible after my husband was paralyzed in a construction accident, and it took years. We had to prioritize, we had to wait our turn, and we're still working on some of those issues. When we needed sewer in our neighborhood, I worked with the DNR, with the city. We got the sewer in our neighborhood. And then working for the league last year, I actually had 8 victories and 3 defeats as the league's lobbyist. And you contrast that to Carol Owens, who after 12 or 14 years in the legislature has been unable to get anything done. I feel I'm the best choice right now to represent the people from the 53rd Assembly District. Not to mention the fact that I'm from Oakfield, so I grew up in a small town, and I've lived in the town of Oshkosh for 20 years, so I have a pretty good feel for and my husband's from Byron, and he's also a Vietnam vet. We just have a broad array of experiences in our background. So I also want to mention the fact that I'm out there talking to people, holding meet and greets, and going to town board meetings, and really setting up a base so that I can keep connected with the people in this district, and I'm looking forward to that. So
all right.
Time to send a bird from the 53rd.
All right, very good. Well, thank you very much for being here, and good luck to you on Tuesday, November 2nd.
Thank you.
Want to encourage everyone to get out and vote. Voting is a privilege, but it's a responsibility, and everyone should take part. We need your help. We just also want to, Melanie and I were at a meeting, a little function up in Neenah a couple weeks ago. I'm going to make this real brief. One of our volunteers on our crew, Darlene Hengels, was given an award. She was given the Friend of Neenah Award for all of her volunteering. This woman, her volunteer efforts are endless. And so, Darlene, thank you. Way to go, and congratulations. So, on that note, I will also thank you folks for joining us. As always, it's a pleasure. Thanks again to LuAnn for being here. For Melanie Bloechl, I'm Cheryl Hentz. We'll see you next time. Until then, take good care and keep your eye on us. We've got our eye on Oshkosh.